I'll be covering broadly the topic of EGFR combination therapy, something that's gotten more complicated in the last year and a half compared to what we used to know about this subject. Let's see, there we go. So my disclosures. So my mini agenda for this talk is to cover, what is EGFR-mutated lung cancer? I know that some folks here attending this session may have been living with EGFR-mutated lung cancer for many years, but there are those who are newly diagnosed. So we'll start out with just some level setting, getting everyone on the same page. And we'll talk about really focusing in on what are the current treatment options for the newly diagnosed lung cancer with an EGFR mutation. How are we thinking about these options? And then we're going to talk a little bit about how does first line of therapy impact choices in the second line and later setting, especially relevant, I know, to everyone who maybe has already had themselves or a loved one has started treatment. So just quickly here, I'm going to try to get my screen working here. There we go. The question is, what is EGFR lung cancer and who tends to get lung cancer with an activating EGFR mutation? And these are the most common actionable mutation that we currently find in lung adenocarcinoma. It's about 15% in a North American population, but say in Asia, Southeast Asia, you can see rates up to 50% or higher of EGFR mutations if you're diagnosed with a lung adenocarcinoma. So it does vary quite a bit with geographic area. On average, people with EGFR lung cancer compared to our broader population of people who have a lung cancer diagnosis, they tend to be younger at diagnosis, are a little more likely to be women, are more likely to have Asian ancestry, and are less likely to have a history of heavy tobacco use. But I do want to highlight that EGFR-mutated disease can affect anyone, regardless of demographics. So this can absolutely strike men, people without any Asian ancestry, older individuals, people with history of smoking can all get lung cancer with an EGFR mutation as well. And that's why it's really important to be doing comprehensive testing or having comprehensive testing, regardless of what your personal background or history are, because we don't want to miss anyone who has one of these actionable mutations, EGFR included, because they can add to the list of treatment options and add some very effective treatment options that we don't want people to miss out on. And I will highlight that almost all EGFR mutations are cancer cell only mutations. So they're not in the rest of the healthy cells in your body. They're not something that's traveling through families. There are a few very rare exceptions, and certainly your oncologist can help sort that out if it looks like you have one of the mutations that sometimes has been reported in families or depending on family history. But usually these, and the vast majority, these are not something that's traveling in a family. Let's see, what is EGFR? EGFR is a gene which makes the EGFR protein, which sits on the cell surface, and it turns on and off during normal function, particularly within, we call it the epidermal growth factor. So the epidermis, which is like your skin surface, basically, or anything in your body that interacts with the outside world. So that's skin and intestines, technically. It should turn on and off as needed, but when EGFR is mutated in lung cancer cells, it stays on too much. When it's on, it sends a grow and survive signal, which causes the cells to be more likely to be cancer cells. And our EGFR targeted therapies, the traditional kind of pill-based therapies that we use that I've listed out below there, they really bind specifically to that mutated form, the abnormal form of EGFR, to help shut it down and stop the excess signaling, while trying to spare binding to the normal EGFR that's in all the rest of your cells in order to try to minimize the risk of side effects. And many of the side effects we'll talk about for EGFR inhibitors are because of the EGFR pills, what they do kind of hitting the normal EGFR as well a little bit, despite best efforts to kind of be selective away from it. We've had many generations over the years, and in fact, 2024, this year is the 20-year anniversary of the original discovery and reports of EGFR mutations as being sort of this actionable biomarker in lung cancer. So we now have 3 different generations of EGFR drugs. We have the first generation inhibitors, things like erlotinib and gefitinib. We had second generation inhibitors, that was afatinib and dagomitinib. And we had third generation inhibitors, which is our current generation of inhibitors, like osimertinib and lazertinib. And those are the drugs that, except with rare exceptions, you're most likely to be receiving if you're being newly diagnosed with EGFR lung cancer in the United States today. And these are all pill-based therapies that bind, just as in the figure shows, to that mutated form of EGFR. Now, there are many different types of EGFR mutations, and they all share the common feature of causing overactivation of EGFR, but they differ in how sensitive they are to our traditional EGFR-targeted therapies, particularly our EGFR-targeted pills, because they all affect sort of the shape of that kind of lock, so to speak, a little differently. So some of them need a different key, i.e. a different inhibitor, to inhibit them most effectively. So this talk is really going to focus on the most common EGFR mutations. These are L858R and exon 19 deletions. And I marked them off on that pie chart there. They make up at least kind of 80 to 85% of the mutations that we find in EGFR when we test, which are actionable. But I will touch just briefly at the end on the other mutations as well, which are that rest of that pie chart there. You can see there's a lot of different other ones that make up the rest of the ones we find. EGFR L858R is one set mutation. It's one of the most common ones. And then exon 19 deletions are actually a collection of many different sorts of mutations that all delete a little segment of this portion of the EGFR protein called exon 19, leading to overactivation. But they do it in just slightly different sizes of the deletions or locations of deletions.